on the topic Decoding Test through Ayurveda. Without further delay, I would call upon Dr. Muralidhara Sharmaa sir, Professor Emeritus, STMCA Udupi, to take over the session. Welcome to you, sir.
I think our voice is audible, no?
Yes, sir.
Okay. Now, in the last session, we had discussed about the ECG as a tool of investigation where the electrical activity is measured, produced from the heart. Now, the electrical activity from other organs also can be measured in the same manner, and it also gives you an impression about the possible activity of that particular organ. And among such electrical activities measured, another important tool which is commonly used is electroencephalography, where the electrical activity produced over the brain is recorded at the specific points. The leads, which are usually 13 sets of the leads, are used, and the activity is measured, which will vary according to the level of consciousness. During sleep, the activity will be lesser, and when you are active, the activity will be more. And in case of the seizures, there will be a sort of a rough activity or aggravated activity, and based upon this, the waves are named as alpha, beta, gamma, their characters. And when there are more of that gamma waves of irregular nature, that suggests about a focal activity. It's an abnormal movement of the vata gati. Vata normally would be a vyahata gati, but if there is a vyahata of the gati, that can be more accurately measured and objectively measured with the tool and capillography. Or similarly, another of the tool where the electrical activity is combined and then is used for study is the electromyography or nerve conduction studies. Nerve conduction studies could be of different pattern, electromyography, or a needle, these poles which are used. That depends upon the real situation which is needed. Not much of a difference there. The basic issue is in the whole theory of the nerve conduction studies, you will be giving an impulse to the nerves at two different points, at a proximal and then at the distal level, and assess the wave which is produced over the muscles, and you can calculate the number of this time taken for conduction of the impulses, as well as it can give you the intensity of the muscle activity, and hence it can study both the activity of the nerves as well as the muscles. If there is an abnormality of the nerve conduction, the time factors from the conduction will be affected, whereas if it is an abnormality of the muscle, the mechanical amplitude of the contraction, the wave, would be affected. So this way we can make out that diagnosis of the real pathology. Now, typically in case of an axon damage in a nerve pathology, if there is an axon damage, then the total amount of the time taken for the conduction of the impulses will be lesser, and the total electrical activity also would be very low as such. Many times the conduction may not reach at all. There could be a blockade, total blockade or a partial blockade. In demyelination, where the nerves would be partially damaged, and some of the nerves would be more active, some of the nerves would be less active, particularly myelin sheath being damaged, the gap between the alpha and the beta activity of the nerves is affected. Now, I hope you can make out that alpha, normally they are supposed to be the fast conductors, beta are the slow conductors, alpha would be having the myelination. In demyelination pathologies, the alpha conductors become slower, and hence the action potential which is formed will not be unipolar, it tends to be bipolar. So that's how the pathology can be made out. So, pathologies related to the nerves conductions, pathologies related to the muscles can be made out with the EMG studies. So that's the common set of investigations which are done to make out the electrical activity of the different organs of the body. Now, another set of the investigations are the functional studies, where the gross function of a total organ and the coordination of those organs are studied, and again you will have many of them the series of them. Again, to go into all of them would be impractical. I'll just refer to only those which are quite commonly done and practiced as such. Among them, the spirometry is one. Spirometry is a abbreviation of respirometry, assessment of the respiration and its volumes. The volumes of the breathing, like the tidal volume, that's tidal volume is the amount of the volume of air exchanged during the respiratory breathing or casual breathing. And then the reserve volumes are that extra volume of the breathing, either inspiratory or expiratory, which can be enhanced by efforts. And then the dead volume is the real space of the lung tissue, the whole respiratory system, and that volume cannot be expelled out. So this way, the different volume studies can be made out. In a person who has a reduced reserve volume, that's the resting condition, patient may have a normal breathing, but if the reserve volumes are reduced, his exercise tolerance will be lesser. So that's it. Reserve volumes, both inspiratory and expiratory volumes, are that much of the capacity of the respiratory system to cope up with the increased demand. Either it could be inspiratory demand or expiratory demand. But more important from that would be in patients who present with the breathlessness. When the patients present with the breathlessness, possibly there are two categories of that cause of the breathlessness, what we call as restrictive diseases and obstructive disorders. Restrictive disorders are those where the total volume of the lung itself is reduced. Either volume of the breathing itself is reduced, the lung itself is reduced, like patients who have a pleural effusion or patients who have a thoracic injury. In that condition, the expansion of the lung cannot occur. They are the restrictive disorders. Whereas obstructive disorders where the passage of the air is thinned out or there is an obstruction. As in case of chronic bronchitis-like conditions, where there could be spasm of the muscles. In allergic conditions, there could be spasm of the muscles, or there could be an obstruction to the air passages. Now, clinically, it may be, it's possible. I'm not saying that it is not possible, but it's difficult to make out these restrictive and obstructive pathologies. And to make out accurately, spirometry can help you. Or many times, most of the patients may have both these restrictive as well as obstructive pathologies, and to make out that, spirometry can be quite useful. Now, these obstructive and respiratory, these restrictive conditions, they are very typically mentioned in case of the Shwasa Prabheda and the different varieties of the Shwasa. When Charaka has explained of the Urdhva Shwasa, there are two patterns of the Shwasa. Dirgham Shwasiti Astu Urdhvam Napratyaharati Adaha, where the patient would be having a deeper inspiration, the inspiratory effort would be more, and the expiratory effort is lesser. This is very typical of an obstructive pathology. And Shleshma Mukha, in that condition, there will be the srotas, the respiratory channels would be obstructed due to the kapha, and hence the patient would have a difficulty in breathing. Whereas in case of the other variety, where the patient would have a restrictive pathology, there urdhvashvase prakupiti, the inspiratory effort would be lesser, and inspiratory effort would be more, expiratory effort would be lesser. Adashvasaha nirodhyate, muhyati tamyataha, he will have now difficulty in breathing because of that, and that's the two varieties of that. Now, importance would be from the management point of view. If you give a bronchodilator to every patient of breathing difficulties, and if a patient has a restrictive pathology, and if you give a bronchodilator, the condition will worsen. Condition will worsen if there is a restrictive pathology. Whereas in obstructive pathology, bronchodilator is the treatment. In case of the restrictive pathology, try to increase the effort of breathing, like exercises, positioning of the patient in a proper way. There could be the helping in the differentiation. Generally, you will see the patients of bronchitis, emphysema with the obstructive phenomena, whereas interstitial lung disorders, patients of obesity, abnormalities of the vertebral column, they will have the restrictive pathology. And this differentiation is quite critical in management of respiratory difficulties. To identify this would be critical. And to identify this, a careful auscultation can help, but more accurate information can be had by the assessment of the lung volume. So anyway, that's about one of the issues related to the functions as such. Now, just a modification of the spirometry and addition of carbon dioxide absorber to the spirometry can give you an idea about the total amount of the oxygen consumed by the person in the resting condition. And this is quite useful to assess the basal metabolic rate. Basal metabolic rate, I consider this as a Dhatvagni. An objective assessment of the Dhatvagni is possible by assessing the basal metabolic rate. Now, the basal metabolic rate, when you advise a patient for the study of the basal metabolic rate, the results which you get will be, it's not very specific like how much of the volume is consumed by that person. Instead, there will be a table of calculation, a formula, different formulas are applied, and based upon that formula, standard basal metabolic rate for that person, based upon either his body weight and the age, either male or female, there is a difference, and these are the different formulas, and I have just selected one of the popular formulas, and based upon that, the standard for that person is calculated. So standard amount of the oxygen which can be consumed by that person during per minute, how many liters per minute, that can be calculated. And this is compared to the actual reading. In the actual reading, the variations of the percentage is measured, and the results usually you get it as variations from the percent. Normal is 100%, and usually 90 to 110% also are considered as normal. Anything below or above is considered as abnormal. So basal metabolic rate is studied in comparison to the average standards of the people, of the person, and based upon the body weight and the surface area of the body or the age of the patient. These are all the criteria by which you can decide about, and that's compared to the patient situation. And it also is related to the status of activity of the person. A person who is in a resting condition, the basal metabolic rate would be lower, and in the active state, the basal metabolic rate would be higher, and hence study of the BMR would require many standardization factors. Standardization factors like temperature of the environment and the resting status of the patient, the physical activity. At least there should be total 15 minutes of absence of the activity to the patient. Temperature of the environment also has to be maintained properly, and then only the BMR has to be studied. So that suggests about the difficulty of measuring the BMR or measuring the Dhatvagni, but still it can be quite useful occasionally. But BMR is not done very regularly, but still it can be done occasionally. Now, another common investigation which is quite useful is uroflowmetry. In the uroflowmetry, the patient is made to pass the urine to a container which has sensors, and these sensors will be recording the amount of the flow as well as the pressure of the flow. So it's a very simple tool where this flow is measured, and then that is the pressure of the flow is given in a form of a graph, and this gives you a clear idea about whether there is a obstruction to the lower urinary tract or whether there is an abnormality of the tone of the bladder. See, the flow of the urine could be affected due to either an obstruction in the lower urinary tract. So if there is an obstruction to the lower urinary tract, the bladder will be constricting more and putting more pressure, and these waves will be produced. If there is a atony of the bladder tone is reduced, there will be no pressure produced, or the pressure produced will be lesser. So this way, the differentiation of the obstruction of the urinary pathologies can be made out. Among the Mutra Ghata, the conditions where, like Ushna Vata, according to Sushruta, is that condition where the bladder would not be able to constrict, and hence the flow would be very gradual, slow. Whereas in case of Vata Sthila, it's the obstruction to the urinary passage. So these differences can be made out more accurately with the uroflowmetry investigation as such. So that's about one more of the investigation. Another quite important investigation which is done would be the fundoscopy. Fundoscopy is actually a visualization. What you can see with the naked eye is enhanced with just a lens. With this dilator, you apply the a midratic drug, and then you with that lens and the light source of light, you look at the fundus. And there is it's a standard protocol in all patients of hypertension and diabetes. It's a universally standard protocol to predict about the possible complication produced due to the hypertension and diabetes, that the fundoscopy is critical. So important is the fundoscopy is not limited only to the eye disorders. It also can reflect you about the base pathologies related to the system. Of course, the other eye pathologies like retinal detachment and retinal atrophy and so on, they are also studied well with the fundoscopy. But in case of a hypertension, the typically coppery vessels, the vessels which are having a very thick and reddish color and corrugated one, with some amount of the exudates present over the retina, is very characteristic of the hypertension. Whereas in the diabetes mellitus, patchy hemorrhages in the retina with the dilated vessels is a characteristic of the diabetic pathology, and these can give you a very clear idea about the possible complications which can produce produced due to the disease. As far as the hypertension is concerned, fundoscopy also is considered as one of the criteria to decide whether the patient requires a treatment or not. There are certain, of course, there is a bit of controversial issue. This issue is a bit controversial issue. There are certain people who are categorized as essential hypertension, in the sense a relatively higher pressure is considered to be normal to a certain set of human beings. Now, whether they really require a treatment or not would be the issue. Patient would be totally otherwise asymptomatic. Only the recording blood pressure would be higher. So in such conditions, to confirm whether the patient requires a treatment or not, fundoscopy can give you a better idea. Any changes in the vessels of the blood, retina, would be suggesting that the patient requires a treatment for the hypertension. Of course, the current guideline is not that. The current guideline is if a patient has a higher pressure, you need to treat. But it was just older guideline, but it has a value. This kind of confirmation with the fundoscopy also has its own practical value. Anyway, that's about the utility of the fundoscopy. Now, another set of the investigations which are rarely done, they're not commonly done, are the assay of the hormones. Among the assay of the hormones, thyroid hormone studies are more commonly done. With the other hormones, only when there is a specific necessity, these are done, and they are not done very commonly. Very rarely they are done. Only when there is a specific reason for that. So we will not go into all that, the significant details of that. But at least certain basic things are, the hormones can be studied from the different methodology and the sources also. Serum, of course, blood is one of the common method of studying the hormone concentration of all. So for all common hormonal investigations, serum studies can be done. But with the serum studies, one problem would be that it's the whole process is elaborate, costly, and then painful. Whereas the hormonal changes in the body, they can be studied from the other sources also, like the saliva, urine, or just applying a spot over the surface of the body with a specific test. So that would be more convenient to the patient. And those areas like the estrone or sex hormones, they can be studied from saliva or even from the urine, depending upon the indications. That can be, so certain of the trouble of the patient can be saved. That's all the point. So whenever we recommend a patient for hormone assay studies, it's not necessary that every patient has to be studied only through the blood investigation. You have the other provisions also. That's all the point. That's all the point which you have to know. And the need for the hormone studies would be very patient specific as such. Now, this the another mode of making the diagnosis would be the test models, common is the IQ test model. Of course, these are assessed as it's a attempt to make an subjective issue into an objective issue. Like either it could be in the form of questionnaires or it could be in the form of some models where the patient's capability of different sorts, the different abilities of the patient can be studied. For IQ test, you have, of course, there are hundreds of such questionnaires like where the person's IQ can be studied with these types of models where the logic can be identified, or similarly perception of the shape of a organ, also shape of any object can be studied by giving the patient with a different sorts of the shapes and so on. So that kind of models also are studied, though they are not categorized as investigations, but this is an attempt to make the subjective and objective one. Very commonly used that the conversion of subjective into objective is what we call as the universal pain scale. In the universal pain scale, depending upon the facial expression of the patient and then asking the patient to point out to the level of the pain he has in a scale of 0 to 10, you can make out objective. These are often studied in your thesis work also. So that kind of the studies also are done as a part of the investigational tool, though it's not done to identify a disease, but these can help in assessing the severity of the disease and assessing the response of your treatment. These kinds of models can be studied. With this, we will conclude our session about the investigations as such. To conclude, the important points are all the modern investigations, the technical tools of the investigations, they can be useful for every clinical practice if they are used judiciously. So all that you have to know is the exact physiology of the investigational tools and how they are done and what's the real value and how to apply to the clinical practice. And it should be used judiciously. Another important is these days the whole medical practice has come to a level where a patient is investigated irrationally and most of the times more than the interest of the patient and the disease, it could be the other extraneous interests which could be the real reasons for the investigations, and this practice should be curbed. And many times there is a claim that the practice should be evidence-based practice, and that concept of evidence-based practice has led to the current situation where the patient is given a lesser priority and the investigation reports are given a higher priority. But now, latest, the people now have realized the futility of that kind of an approach, and hence there is a view of looking back. Of course, in the olden days, the situation was absolutely very methodical. As I referred to you earlier also, like in the olden days, in the 80s, there was a method of medical audit. In the medical audit, those physicians who would have more than 50% negative results of the investigations done, they would be cautioned and that their practice would be considered as substandard. Whereas now the situation is totally different. A person who has not done any investigation, he may be considered as a poor quality practice. So quality of the practice and assessment has been changed. But the reality is that the investigation should be done only when there is a absolute necessity. And that absolute necessity can be made out only after a proper clinical assessment. And another quite important is a clinical assessment is the ultimate, and it's not that the investigation which should confirm the disease, it should be the clinical assessment supported by the investigation which should confirm the disease or any of that information. The investigational tool cannot be a single factor to make a final decision as such. That's the important. And in all situations, whenever you have all the other branches supporting like radiology or the pathology and so on, all that opinion given by those different specialties can be only supportive, but the final judgment about the disease and management should always be by the clinician. And with this, we'll conclude like what Charaka has said, Shastram Jyotihi Prakashartham. So all that what's mentioned in the Shastra text is the basic guideline, and any of the tools which are available in the universe, They have to be used, then only we'll have a successful clinical practice. With this, we'll close this chapter about the investigations as such. So we have completed a bit early. If there are, I think, if there are any questions, we can answer, and then this session about the investigations is concluded. There is a question like Taila Bindu Pariksha for Mutra, any logic? Of course, the whole issue is the logic, very simple logic is about the specific gravity, but as far as the shapes of the Taila Bindu and so on, the current knowledge of physiology and current knowledge of physics is not able to make out that kind of an assessment. A shape of the, see, as far as the other factor, like whether the oil spreads through, whether the oil can just dip through, that can be definitely having some rationality. But shape of the drop, giving you an idea about the issue, like maybe the prognosis, it may not be possible to assess with the current terminology or current knowledge of the physics. But again, quite important is if we are not able to explain any phenomena with the current knowledge of physiology, that doesn't mean that that factor doesn't exist. It could be still be true. So it's quite possible that all those are maybe true and they need to be tried and assessed. There is no need to find a reason. So if at all anybody is, I don't know, I don't give a definite opinion on that part, but if at all there is any who is interested, I would say like you just go on studying this Taila Bindu Pariksha, correlate to the results in terms of the prognosis or the disease diagnosis, and if we can substantiate that these factors do exist as a cause and effect relationship, then it has to be accepted. There is no need to justify or no need to give the reason in the current terminology. The language which we use is now in the current language is something different, and the language of Ayurveda is something different. And this language difference doesn't mean that anything is true or false. So that's not the issue. It's about whether you can comprehend or not. So I would say like it's difficult to comprehend with the current knowledge about the utility of the Mutra Bindu Pariksha. I think I have given the answer satisfactorily. Right. Sorry. Any other questions? Right. If there are no more questions, I think we can conclude.
Thank you, sir.